Talk to me. WSRadio.com.
Welcome to Performance in Motion with your host, Dr. Dennis.
Okay, folks, we are back. Dr. Dennis, joined by Dr. Brenton Wynn, medical, sports medicine, pain management expert. What's up, dude?
Hey.
Okay, that was not scripted, folks. That was real. All right, Dr. Wynn, I really am curious about this new technology, so I'm going to let you go into detail because I still have to learn about it.
Well, just break it down a little bit, basically, huh?
Yes, please. Break it down, buddy.
So what I had the opportunity to do was to train and do some exchange with Dr. Robert Odell's up in Nevada, Las Vegas area. He has a Neuropathy Pain Centers of America, and he came up with a protocol to treat neuropathy. So neuropathy is basically the dying out or the death of nerve tissue in the body. Most common in this country, it's a complication of diabetes. People will describe burning, tingling in their feet,
right.
Pain, hypersensitivity, anything from the sensation of electricity running through their feet to ants or bugs crawling through their feet. Just a number of different abnormal sensations, and mostly they're painful sensations. But even just numbness can be considered a symptom of neuropathy. So the downside of that is typically those patients have poor circulation.
Yes.
They end up with other complications. If you can't feel, you tend to have damage to the tissue. You develop an ulcer on the foot, poor circulation, the ulcer doesn't heal, and the next thing that's happening is someone's getting portions of their foot amputated. So we want to prevent that. We want to, change that. And really there's not much out there that actually treats neuropathy. We have therapies that will help to control the symptoms, but an actually treatment, regenerate the nervous tissue,
Yes.
and to heal it is not very common in Western medicine.
Can I ask you real quick?
Yes, sir.
Because you have my brain going 100 miles an hour because I'm a science nerd. So what are some of the primary causes of neuropathy? Because a lot of people that I run into use the word because they're just regurgitating what they heard from their doctor.
Well, yeah, exactly. I just regurgitated it from some lecture I heard in medical school.
Very
so
cool.
I'm doing the same thing.
Okay.
No, but to be real, there's a number of different reasons. So we typically classify diabetic neuropathy as a metabolic neuropathy. So something's happening in the body that is there's a abnormal condition. So with diabetes, typically the small blood vessels get destroyed, and so you have no circulation to those small nerves, the nerves in the skin that provide sensation, and then you get dropout of nerves in the muscles and other ligamentous tissues of the if we're just talking about the foot. So that the foot doesn't function correctly when walking.
Yes.
And then that's a setup for just mechanical breakdown of the skin and on other problems. The also the sugars, when they're high, they actually bind to the nerve tissue. It's called glycosylation, and that destroys that just kills the nerve cell. Oftentimes we see neuropathy in other what we call chemical neuropathies, not people that are excessive alcohol use can cause that.
That makes sense.
A chemical neuropathy, people that are undergoing chemotherapy, sometimes that medication itself will destroy the nerve tissue. Heavy metal toxicity, not generally found in this country so much, but it does occur.
Okay.
And then idiopathic neuropathies. We just don't know why it happens, but it does.
Right. So under that would be somewhat structural, which could involve, vertebrae, discs, nerve roots. Is that correct?
Pretty much any reason. I mean, I treat a lot of patients with back and neck pain, and one of the sequelae of that is that they have some sort of nerve impingement or some nerve involvement, and then you get abnormal signaling, and oftentimes people describe that as sciatica or radiculopathy. But even something like a carpal tunnel, which is a compression or
Yes.
An inflammatory insult to the nerve, can present with the same symptoms as neuropathies. So there may be just some mild damage or temporary damage, unlike maybe diabetic, where there's actually death to the tissue, to the nerve tissue. But we're looking at how do we get those nerve tissues to kind of come back to life again.
And what I love about this new technique that you're going to share with us is that although you're an MD and obviously there are interventions that work chemically and with medications, pharmaceuticals, this is actually primarily a holistic approach.
Absolutely. It's energy medicine. So, there was 3,000-year-old recordings of using electricity to treat conditions. The electrical fish in Egypt and so on and so on. And so electricity has been utilized for many years, even in modern medicine, to treat certain things. I mean, we use electrocardiogram to identify cardiac problems, the EEG to identify seizure disorders or abnormal brain activity. So we're just using electricity not just to diagnose, but to actually employ as a treatment. And what we found is that basically with certain frequencies, you can actually get what's called cell signaling, which is basically turning the cell on and having the cell do its normal physiologic function that it lost because of either damage like neuropathy or a chronic pain condition where you get abnormal processing of something, whether it's the pain pathway and signaling. And what happens is when you get those abnormal processing, then you get abnormal cellular responses. So
makes sense.
Chronic pain leading to chronic inflammation, leading to musculoskeletal dysfunction, and so we're trying to reverse that.
So with this specific approach, I want to pretend that, let's say I'm the patient. So if you were going to sit down with me, what am I going to expect? What kind of commitment, time-wise, things like that?
Absolutely. So just to give you a little background, if we're speaking about neuropathy in particular, the nerve regenerates at about 1 to 3 millimeters per day. So
what does that mean in English?
That means in English that if you have a nerve injury, it's going to take a long time to heal. Okay. That's going to be longer than your basic. If you fractured your get on your skateboard, flip off your skateboard, land on your hand, and you fracture your arm, 6 to 8 weeks tissue healing time. You're going to be in a cast.
Oh yeah, I just did that about a week ago.
Nerves do regenerate, but they do it a lot more slowly. So when you're talking about brain injuries, spinal cord injuries, even peripheral nerves, you're talking about carpal tunnel syndrome, or you actually cut your thumb and you lacerate the nerve. It's going to take 1 to 3 millimeters of regeneration per day. Okay. So depending on how long that nerve has to travel, it's going to take a little bit of time. What happens with this electrical signaling therapy is that we actually accelerate that. So you're getting 5 to 15 millimeters of regeneration a day. So you're advancing that because you're turning the signals of the cell on to naturally regenerate themselves. Also, the electrical signal also provides an anesthetic block, which eliminates some of the pain. And it's not just a temporary block. You get prolonged blocking, so you get symptom management as well. And there's a lot of other physiological factors, but if you were to tell the cell to do everything it needs to do to heal itself, if that's 120 different functions, it starts to set that progress.
Wow, that's definitely advanced. So let me ask you, what would be the frequency, like how many days per week for how many weeks?
Well, for the standard neuropathy protocol, 3 times a week, the session's about 20 minutes where we have you connected to Synexus, which is our electroanesthesia device. For the first 2 weeks, just that therapy by itself.
Okay.
Weeks 2 through 4, we're going to do a series of nerve block injections. We're just going to use some bupivacaine, which is a local anesthetic.
Okay.
That enhances the block as well as the nerve regeneration portion of that. And so we just go back and forth, alternating those two therapies. So 2 weeks of just the electroanesthesia or electrical chemical therapy. I'm sorry, the electrical cell signaling therapy, and then we do the combined electrical chemical therapy, which is the injections along that. And typically for neuropathy, it'll be 8 to 12 weeks.
Okay. That's really not a tremendous amount of time, considering, and you can correct me if I'm wrong, that a lot of these patients that have suffered from neuropathy, sometimes it's been 10 to 20 years of this.
Well, not only that, but when you have someone that had pain just getting up and walking to the bathroom, and now they're able to ambulate to the bathroom and dance with their spouse or play with their kids, it means so much more. You're talking quality of life.
So it's not often that in the health field, the medical field, even the holistic side, that we see something that can offer healing and minimizing pain or decreasing pain simultaneously. Absolutely. And that's why I really have fallen in love with this therapy. The other things that we're facing, and anyone in the pain management world and just about everyone in this country, is we're dealing with what's been termed as a opioid crisis, and yes. There's been too many opioids dispensed, and we're having a backlash of opioid-related deaths. Okay, folks, unfortunately, the time is flying by, and we are coming to the end of this third segment. Dr. Nguyen is a plethora of knowledge, and he's also very pleasant to speak with. So in our last segment, we will be talking about a little more of this and some more fun things. This is Dr. Dennis at WSRadio.com, the worldwide leader in Internet talk. See you in a little bit.
Hi, this is Rob Barnett, CEO and founder of VinVillage.com and the Wine and Dine Show on Vin Village Radio. Do you have a wine, event, product, or service to promote? Then contact VinVillage.com to reach thousands of wine lovers across the country. Vin Village connects like-minded wine enthusiasts with unique and exclusive wines, events, products, and services. To learn more, contact us on VinVillage.com. Vin Village is where wine lovers connect.
Life is full of misadventures, from car crashes to home fires to getting choked out on the mat. Yes, I said getting choked out because I'm Carlos Kramer, jiu-jitsu competitor, MMA and media personality, and mild-mannered insurance agent. You can follow my adventures on Kick-Ass Radio, and I can protect you from life's misadventures at Kramer Insurance. Home, auto, life, business, and workers' comp. We're at KramerINS.com, and I want you to join my world.
You've heard me bragging about Progressive Medical Center and how they've helped me feel so much healthier. But one thing, Dr. Agoli, that a lot of people come to you with is just unexplained pain. They just can't get any relief. Why can Progressive Medical Center's Pain Management Center help them?
First of all, we have to acknowledge that pain is for real, and you've got acute pain and chronic pain. Here's the problem. That acute pain turns to chronic, which is long-standing, and no one's getting to the root cause. There's several key diagnostic components that help us get to the root of what's causing this pain. Is it inflammation? Once we do a thorough evaluation to get the root cause, determine if it's structural or if it's a metabolic issue. And this way, we put an individualized program for pain management involving correcting the spine, using certain injections when necessary, and we get our patients out of pain quicker, and they stay out of pain because we teach them how to live their life well.
Don't let yourself live in pain any longer. Get a hold of Progressive Medical Center today at ProgressiveMedicalCenter.com.
Progressive Medical, this is your life, live it well.
Nowadays, internet devices are an integral part of your home. Everyone in your family has a smartphone, tablet, or a computer. Life is easier knowing that all your devices are secured and your family can surf the internet carefree. ESET Multi-Device Security Pack does just that. One license for all your devices. With ESET, it's simple to stay protected and save money. Enjoy safer technology with ESET Multi-Device Security Pack at ESET.com. That's ESET.com.
You take your smartphone almost everywhere you go. Now WSRadio.com can be there too. Search WS Radio in the Play Store for your Android devices or iTunes for Apple and download the WS Radio application. WSRadio.com on your phone and in your ear everywhere you go. Download the WS Radio application. Do it now. It's very easy. WSRadio.com.